very excited to welcome you tonight to our Facebook Live event on everything that's blocked noses, allergic rhinitis, sinusitis, whatever you want to call it. It's a problem that about 1 in 3 of us suffer from and causes significant problems. I'm Dr. Marinda McDonald, coming to you live from Facebook. And with me, I've got a wonderful panel of Dr. Katlego Mositu from the Steve Biko Academic Hospital, a specialist ENT surgeon, as well as a very brave patient, Seema. We are very excited to talk to you tonight. We hope to have a great conversation. Please post in the comments. We will answer everything that we can live. What we can't answer live, we'll get back to you. And we hope to have a fun, informative evening. Our event is sponsored by Viatris, which is essential for our healthcare education. And we hope to have a wonderful conversation. Get your cups of tea, hot chocolate ready as I fire my first question off to my colleague Katlego. And Katlego, what is allergic rhinitis? Do you want to share symptoms, signs? Is it a cold? Is it flu? What is allergic rhinitis?
Good evening, Marinda and the panel, and thank you for the invitation, for a wonderful invitation. Allergic rhinitis, is relatively common, and like you said, it affects 1 in 3 of us. And basically what it means is just that it's inflammation of the nasal passage, so in simple terms, and patients usually present with watery nasal discharge. They may present with itchy eyes, itchy ears, itchy palate, and sometimes they may have what you call a postnasal drip, which in simple and layman term we call it throat clearing. And the signs that one should look out for on clinical examination is that they may have what you call allergic shyness. So what is allergic shyness? Allergic shyness is darkening around the eyes, and that may look like bruises. Sometimes they may have what you call a nasal crease because of chronic rubbing of the nose upwards in like a vertical direction. And also they may also have what you call epiphora, which is watery watering eyes. And what we clinicians look out for on examination is that they may also have what you call cobblestoning when we do oral examination, where you see, it basically looks like cobblestones because of the chronic postnasal drip. And also when we do anterior rhinoscopy, basically when we look into the nose, on the lateral nasal wall, what we see is that the turbinates. So turbinates is the bulging of your, we call it concha. You find that bulging and it may look pale or it may look purplish in color. And what you see as well is hyperactive nasal mucosa, which is, like the nose behaves like, it's tearing. And that is because of the allergen. And usually there's an inhalant that you could be exposed to, like your pollen, could be from trees, grass, or weeds, or could be of house dust mites, could be, so many other things like your cat's dander, your dog dander. It's usually because of inhalants. Yes. Any more questions?
So Katlego, that's a beautiful description of it. And, we talk about the allergic shyness, the allergic salute, and our nose sprays that we use for that. Would be the mainstay of treatment. And we would use them on an ongoing basis. I think one of the problems we experience is the absolute chronicity of this problem, is that this problem does not stop as long as you are exposed to it. And we are struggling with that this does not stop. A cold and a flu, you have a cold, comes, and then it passes away. But with allergic rhinitis, you sit with this chronic cold. And it's often mistaken for colds. Am I right, Katlego?
True. So patients will usually tell you that, I have this chronic cough, or I think I have an infection which is not going away. and not knowing that it's basically because of the postnasal drip, because of the allergic rhinitis. So one should understand the typical symptoms that patients present with, or like your itchy eyes, itchy ears, your rubbing of the nose, and watery rhinorrhea. So it must not be confused with an infection, of which an infection you won't get a clear nasal discharge. It will be.
I think our patient Seema can give us a bit more information here. She has been struggling with this. She lives with it. There are times that she struggles to breathe. She says there are times of the year that she really, really struggles. So Seema, do you want to tell us about your experience? Maybe give us a bit of background, what happened, and then we can just elaborate on what your journey so far.
Thank you, Marinda. Thank you, Dr. K. Maybe just to give you a brief of my background, I was born in KZN, which is KwaZulu-Natal, in a very polluted area where they actually manufacture paper. It's called the SAPI area. So usually I was a very sickly child growing up. In my early years, I would usually get those asthma symptoms. I will sneeze a lot. I couldn't use my nose even when I was breathing, ever since from my early years of childhood. And then I will just, always having mucus running out of my nose and stuff. Well, by that time, because I was from a poor background, we thought that it's just normal. But when I started coming from my tertiary years in my sophomore years, that is when I realized that, no, you know what, I am struggling and I'm not living a normal life. Then I started working, starting to provide for myself.
I think what Seema is describing is a very difficult phase for patients, is that they don't really understand what the problem is. So she's a child, she's sickly, and everybody just says, she needs to get on with it. And I think it's a very common problem that patients experience. Seema, we lost you there. Are you back for the moment?
I hope I am back. I don't know what's happening.
Yes, we can hear you. Do you want to I think we've lost her there, but she'll be back, because Seema has been very motivated to tell, because she's really struggled with allergic rhinitis, and we've been getting some questions. So maybe Katlego, do you want to maybe answer some of our questions that's in the feed? We've got a very live audience here. I'm kind of trying to read as we go along. People are really posting about their children, their family. Katlego, do you want to maybe read one of the comments for us? And then Seema, you're back. Thanks. We're going to talk to you now. Katlego is going to answer one or two questions. We'll get back to you, and we really want to hear your journey further. Katlego?
Okay. Hi, panel. We've got a Facebook comment from Patricia. It says, hi, panel. Both my kids, 9 years and 6 years, suffer from allergic rhinitis. Their noses leak clear mucus non-stop. They also develop a constant cough during a period. I have given them antihistamines and nose sprays. Is there anything else we should try? So I wonder if Pritiska has consulted either the ENT specialist as well, because we don't know if this is true allergic rhinitis. And basically the intranasal corticosteroid, they work very well if it's true allergic rhinitis. So history taking is very important, and clinical examination as well, to rule other causes of rhinitis, and to make sure that we're not dealing with any other morbidities, because we can have things like allergic fungal rhinosinusitis, which typically presents like allergic rhinitis, but those ones you will have other signs on examination, like the patients will present with their eyes that are proptosed. They may present with also facial asymmetry. So we need to make sure that we are dealing with allergic rhinitis, and that is diagnosed accurately, and the patients are receiving adequate treatment, and the treatment is delivered adequately as well. So I think we're going to have a discussion about that, the use of nasal sprays, maybe the nasal spray.
I think what Ketlecho is saying is absolutely right, is that we need to have our delivery devices. We've got a beautiful video for you to show that sometimes we just don't use our nose sprays correctly. And she's absolutely right. I'm going to answer one quick question before we get to which resources you can access to have this. This is Lynn Williams, a Facebook comment. I had a turbinate reduction in August and September and a sinus cleanse, but I've noticed it seems symptoms are starting again. Is this normal? Lynn, unfortunately, this is normal, and this is the cause of allergic rhinitis, is as long as you are breathing in what's causing your problem, you will experience symptoms. And the surgery is there to resolve a partial part of your problem, but the maintenance is super important. And that brings us back to tonight's discussion, is that your intranasal corticosteroid medication, nose sprays, correctly administered at the correct dose on a chronic basis is what's going to keep your symptoms at bay. Surgery does not cure us. It helps us improve our symptoms when it's just not possible for our medication to work anymore. But absolutely, maintenance therapy is very, very important going forward. So we hope to please stay online, because we really want to see you to see the videos of how to use your medication correctly. I'm going to take one more question, and then we'll Katlejo will discuss the possibly some of our clinics available. I'll also touch on that. This is from Letsejo. She says, my daughter has those symptoms nonstop, even when we remove the triggers. What else can we do? Post-nasal drip, yes, watery eyes, it never stops. Letsejo, we need to possibly, if you've used medication, the correct medication, then one should possibly look at using your medication consistently, or getting an allergy test. Not every patient with allergic rhinitis needs an allergy test, but if we're not finding the triggers, then that's the case. But often patients are polysensitized. Ketlejo, you can agree with me there, that it's not just one trigger, just removing the cat. Sometimes it's the dust, it's the pollen, it's the pollution. And so an allergy test could be helpful there.
That's true. That's very true.
Ketlejo works in a wonderful unit. Ketlejo, do you want to tell us what resources we've got available?
So we've got the Pet's Pulmonology Clinic at Steve Academic Hospital, and I also believe that there are other state hospitals or clinics across the country which offers, treatment for patients presenting with allergic disease. We also have rhinology and base of skull clinics in our institution, and also, across the country, especially in Cape Town as well. So there are clinics out there, and also in some private clinics as well that specializes with allergy diseases, like yourself, Marinda. So, and we also have platforms like your AFSA, which is Allergy Foundation of South Africa, where you can get more information, and it's freely given, easily accessible. We will share the link so that people can have easy access and understand how to deal with allergic rhinitis.
Yes, and I think we'll bring Seema in here to talk about her treatment, what she's been using, what's worked for her. But the basic treatment of an oral antihistamine and an intranasal corticosteroid is available on state tender. So even at your local government clinic, you are able to access those medications. You would need to know which one to ask for, but it is available to you. Antihistamines work for itch, run, sneeze. I always say to my patients, it's easy to remember. That's the itchy eyes, runny nose, sneezing. And your intranasal corticosteroids works for the congestion, blockage, and the postnasal drip. Seema, what treatment are you using? What's worked for you?
Okay, what really worked for me, I hope you can hear me.
We can hear you wonderfully. Thank you.
I'm battling with
So the intranasal corticosteroids, Katlego, do you want to describe to us what they are and what we use them for in allergic rhinitis while we wait for Seema?
Yeah, so now, Marinda, fortunately, we now have what you call combination therapies. So it's not just an intranasal corticosteroid anymore. We have antihistamines as well in it. So it's an antihistamine with an intranasal corticosteroid in one bottle. So you don't have to be using different medications. And what I like about combination therapies is that they foster adherence, and you are certain that patients will definitely take the treatment because it's easy to use. It's only one bottle. You don't have so many other medication. However, before you use your intranasal corticosteroids and your antihistamines in which are combined, you need to clear the nose. And how do we clear the nose? We say just rinse first, use your nasal douche. Nasal douche comes in a form of a Silex sinus rinse, which is a 200 ml bottle. You can get it over the counter. It's available at Clicks, at Discam. That you rinse your nose first, and after rinsing the nose, then you make sure that you blow out everything, you clear your nose, and then you can apply your intranasal corticosteroids. The intranasal corticosteroids they are symptoms controllers. We call them symptoms controllers, and the antihistamines, they just relieve your itch, your sneeze, and the watery nasal discharge. While the intranasal corticosteroids, they make sure that you have a longer term relief, like you get a relief for a longer period of time, and they should be used continuously. So what is unfortunate is that patients use intranasal corticosteroids only when now they are in trouble, when they feel that they are really blocked. And then when they feel fine, then they stop it. And then they come to you 3 months later, 6 months later, doc, I have that hay fever again. So what is important is that they need to be used continuously, not as in when you feel like, now I'm blocked, I need to go to the doctor, but you need to use them continuously. I think
Absolutely.
Seema can actually attest to that because she recently had a flare of dysphonia, which could be due to a postnasal drip because she had an interruption, with the intranasal corticosteroids and antihistamine. Maybe she can, tell us more about that.
Seema, do you want to tell us about that?
No, I'm being exposed in a way because at some point I felt better after I used the combination, and I was like, you know what, I can go back to my normal self. Then after a few months, I had to go back to her, and that's when she told me on the importance of using the combination continuously. So now we've started again with her. I think now I'm better because I no longer get those constant post-nasal drips. That's very painful because you cannot even enjoy your meal. When you swallow, there's something that follows whatever that you swallow. Your esophagus, it gets irritated in such a way that you don't enjoy your life at all. And it's seasonal. When it's winter, it's something else. And when it gets to a spring, fall, it's something else. And then you get sick for the whole of 365 days. So I think now I just need to get it into my head that I have a chronic rhinitis, and I need to stick to whatever that my doctor is prescribing to me and follow it consistently. So it's my fault. It's not hers. She did her best.
Seema, I think that's a very common problem. We all believe that once we use our medication, we're better, that you must have improved. And so I don't think that's an uncommon problem. Absolutely. the advantage of so intranasal corticosteroids alone take 24 hours to 7 days to have an effect. Our combination drug has an onset of action 5 to 15 minutes. So in that case, once you've maybe forgotten a bit, life got busy, then you can use it as needed. But absolutely, consistent use is going to give you an improvement.
Thank you so much.
We've got our videos now. So we talk about nose sprays and how to use them, etc. And we've got 2 videos that's going to show you how to first rinse your nose, which is super important. It clears our airways. And then the next thing is we're going to have a nose spray, correct administration of your intranasal corticosteroid. And I actually think we'd like to have a bit of questions afterwards, because the questions are coming so fast that we'll have a question about that. And then I think we'll answer 1 or 2 questions. Katlego, if you can answer 1 question for us, and then Seema can answer about her experience with antihistamines specifically, oral antihistamines.
Nasal washouts or irrigation helps you to clear snot from your nose, to improve your airflow in and out, and to allow your steroid nose spray to work properly. Nasal washouts can be done with special bottles that you can get at most pharmacies. These look a bit like a soft baby's bottle with a nozzle attached that fits into your nose. Before you use your nasal spray, it's really important to blow out all the snot out of your nose or use a nasal washout. Otherwise, when you use your spray, the medicine just goes into that ball of snot and doesn't reach the place that it needs to be in order to work.
Okay, so now the video that is the use of intranasal corticosteroids. So make sure that your head is tilted slightly forward and your chin is tucked in. And then the nozzle of your spray should be inserted in the nasal cavity, and it must point to the corner of the outer eye, or to the, to this ipsilateral ear, which is the same ear. Make sure that before you spray, you must activate your spray. You must shake it to at least 6 times and then activate it, and to make sure that there's a mist coming out. And then when you spray, you are targeting the terminates on the lateral nasal wall. In that way, you have a maximum effect. After you spray, you inhale slightly, not too much, so that the medication doesn't, get swallowed. And then after you spray, you just say, take a slight deep breath, and in that way, you'll have a maximum effect.
I think Morel Titus might benefit from intranasal corticosteroids. He says that my struggle is at night. My nose gets so dry and stuffy, I battle to sleep. The minute I lay my head, I get congested and barely sleep. And cetrazine makes me feel worse. My mouth gets so dry. Do you know what to do, please? Morel, I think if you find yourself an intranasal corticosteroid, and you use that on a consistent basis in the evenings before, with a correct technique as we've showed you, I think that would make a significant difference. Oral antihistamines can have a significant side effects, especially the first generation ones, the older ones. Cetrazine is not an older one, but it depends on what your sensitivity is. So some people are more sensitive to the side effects of oral antihistamines. Jenny Pitts asked, does allergic rhinitis cause polyps? Dr. Katlego, I know this is a source of an entire lecture, but if you can do that for us in 2 sentences, do they cause polyps?
Actually, this is one of the things that I tell my patients. If you don't control your allergic rhinitis, in a long run, you've got a risk of developing nasal polyposis, definitely. The link is not clear, but it does happen in a long run. So patients who have allergic rhinitis, in a long run, they have the risk of having allergic, nasal polyposis. So it is important to treat your rhinitis so that you don't develop polyposis, because we've got what you call Sumter's triad. So Sumter's triad is where you have nasal polyposis, where you've got asthma, and you've got sensitivity as well to your non-steroidal anti-inflammatories. And it usually starts with allergic rhinitis, which is uncontrolled before it progresses to nasal polyposis. So there is a risk of developing nasal polyposis if you don't treat your allergic rhinitis, definitely.
So Jenny, I think the nasal polyps, once you get to the stage of nasal polyps, having an allergy test is worth your while. 30% of patients with nasal polyps and a condition called ARD, Sumter's triad, NERD, which is this combination of polyps, asthma, and aspirin allergy, can have allergic rhinitis. But the big differentiation between the two is that your aspirin allergic patients are significantly sicker than your allergic rhinitis patients. So if you do struggle with polyps, have an allergy test and have a look at whether there's, and if you have asthma and an aspirin allergy, that is something to consider. One of the big giveaways there is that allergic rhinitis does not generally take away your sense of smell. So if you've got a loss of sense of smell, that might be a warning sign that you're not dealing with allergic rhinitis. You might be dealing with something else, and it needs to be investigated further. Seema, did you use antihistamines, and what did you find worked for you? And did you experience any side effects?
No, I think I would agree with you that that was the combination that she gave me. It was very much effective. It worked for me. And as I have mentioned that, after I've seen that I was better, I thought it was gone because I did not know that it was a bit chronic. It's something that I needed to use like on a daily basis. But it actually worked. For me, I'm not going to lie, the antihistamine really worked, the steroids, so you call it. It really worked. And also, maybe some of the things that also she recommended, the humidifier, because I stay in a very busy area. I will humid my house and then use my combination and I'll be okay. Then afterwards, I thought I was fine, only to realize that I needed to go back to her after 3 months.
I think Tumi is on the opposite side of you. So Tumi Marake says, I'm asthmatic, have rhinitis and struggle with a lot of allergies. I take meds every day. Is there something that I can take instead of daily meds? Katlego? This is my hobby horse. I love this, but I'm going to let Katlego take this and maybe I'll add something.
Okay, so the patient has allergic rhinitis and doesn't use the sprays, right? Am I correct? He's not using the sprays.
She's using it, but she's kind of tired of it. So she wants, she's like, people get tired because why does this medicine not cure us? I think that's the most common thing I find, Katlego. Don't you think that people get tired of using the medication?
I think so too. I think so too. Hence, education is very important, like emphasizing that this is a chronic disease and continuous use of intranasal corticosteroid is recommended. So what's nice about intranasal corticosteroids that they have fewer side effects compared to when you are taking your oral corticosteroids. So, and if they're used correctly, then you avoid the side effects of them, of which some patients may complain of epistaxis or what you call nose bleeding when they use the intranasal corticosteroid incorrectly. So the importance of emphasizing the use of intranasal corticosteroid can never be taken away. We need to emphasize the use of intranasal corticosteroids.
That's absolutely right to me. Katlego, sorry, but to me, there is other options. So unfortunately, they're all quite pricey and they're not available always as easily. Something that I do in my clinic is we do something called allergen immunotherapy, which is a process by which we test you. We see whether you're allergic to cat, dog, grass, tree pollen, and we then would inject you with this treatment, or there's drops under the tongue. It's a 3 to 5 year process. It is pricey, and so generally only patients who really are not responding to those treatments would opt for it, or people who really don't want to use medication. So there are other treatments, but they tend to be on the more expensive side, whereas your corticosteroids alone, antihistamines alone, or your combination therapy will give you really good symptom relief at an absolutely cost-effective way. I'm going to just maybe scroll down and this is a common one. Somebody says, I get sores in my nose from using the steroids. What can I do to prevent it? Katlego, what do you advise your patients? I mean, this is a common thing. They'll end up with nosebleeds. They'll end up with the sores in the nose, discontinuing therapy. So from an ENT perspective, if you what do you look for with nosebleeds, and what is your advice?
Okay, for patients who present with recurrent episode of nose bleeding, I usually make sure that they're using the nasal spray correctly, because sometimes it could be the side effect of improper administration of your intranasal corticosteroids. However, I also look out for other things that can cause nose bleeding, because we can have other pathologies. But if it's clear allergic rhinitis, then most likely is the incorrect use of your intranasal corticosteroids, and that can cause dryness as well. So it's important that you keep your nose moist. I tell them to apply like emollient, like a Vaseline, to make sure that the nasal cavity is moisturized as well. However, if there is a discharge which is yellowish or greenish in color, then also advise them to seek to come and we do our nasal endoscopy to make sure that we are not dealing with a secondary infection, because you can have allergic rhinitis but also secondary infection as well, other diseases on top of allergic rhinitis.
Vaseline, please.
Yes.
Everybody that knows me knows I'm a petrolatum fan. Vaseline, I think the two are interchangeable, but we I think people just explain to people why they would use Vaseline, and where to administer it. Do they put it on the outside? Where does this Vaseline go, and why do we use the Vaseline, especially in our dry, high felt? Maybe just give us a bit more information on that, because I think that's really beneficial.
Yes, because in as much as it's simple, we just call it a Vaseline, but it works, and it works for me as well, because we tend to get dry nasal cavity, and in that way you get erosion of your vessels, like your vessels that supply the little area. We call it the little area, the area on the septum. Then if you get that erosion, you may have nosebleed as well if you've got dryness. So hence it's very.
Can you just
so little area is that area on the septum. So the septum is the bone and the cartilage that separates the two nasal cavities. So little area is more on the anterior aspect on front. So we just put the Vaseline in the vestibule and make sure that you also apply on that area. We call it the littlest area, which is in front on the cartilaginous septum.
And it gives big problems. I always say there's 4 things. The one is incorrect technique. The second thing is the dry air. The third thing is love for picking things. Kids find amazing things in their noses. Yes. And then if you hear my teenagers, they blow their noses. So they blow their noses really, really hard. And your Vaseline solution is an absolute winner. And it really does make a difference. I think Seema just had a big sneeze there.
Yeah.
I think she's struggling with her rhinitis there. I think what we from our questions here is that we have Timbishle Ambrai, and she says, I'm asthmatic. I struggle daily with chest wheezing, shortness of breath, itching and sore eyes. When the weather changes, I get sick very bad. I must visit the hospital. What can I use that I don't get sick so much? I think, Katlego, we've labored the point, but please, Tim, explain where the lungs start. I always say the lungs don't start down here somewhere, but where do the lungs start?
So, we have what we call a unified airway. So the unified airway starts in the nose, goes in the throat, and also goes down to the lungs. So hence we work closely together with the pulmonologist, or it can be pediatric pulmonologist or, a physician. So while you control your nasal cavity, then it's easy to control the lungs as well. I usually tell my patients, especially who present with recurrent attacks of asthma. I've seen so many patients who come in with acute attacks or, several hospital admissions because they are not controlling the nasal cavity. So if you control the nasal cavity, make sure that you treat your rhinitis, then you will have your asthma controlled as well. So that is very important. And I've seen patients whom we've treated, allergic rhinitis, or who are on combination therapies that do very well, and their hospital admission rate is reduced. I had one patient who was admitted 5 times at least in a year due to recurrent episodes of asthma. And I thought it was Santrust triad. I thought the patient was allergic to aspirin and had nasal polyposis. When I did nasal endoscopic examination, when I checked into the nose, there were no polyps at all, and it was just severe. It was just a moderate to severe allergic rhinitis, which was impairing her quality of life and also causing recurrent episode of acute asthma attacks. And after we started the treatment, of which it was a combination of antihistamine and intranasal corticosteroid, then she improved. The rate of hospital admission were reduced.
That's very common, and I often would say to patients that allergic rhinitis responds well to treatment, but the consistency is key. Ilse Cornelissen-Neuwolf says the opposite. She says, I use my steroid spray after cleaning my nose with saline spray twice a day, and I still have a postnasal drip every day, 365 days of the year. I'm at my wit's end. Also, I must say, if you are uncontrolled when you are doing your saline rinses, your intranasal corticosteroids, there's 2 options here. I would consider a combination therapy or a combination intranasal corticosteroid. And the other option is that one really considers allergy testing. Not every patient with allergic rhinitis needs allergy testing, but if you're not responding to therapy, let's see, is there a cat, is there a dog, and understand what you're testing. If it is the environment that one manages that, consider immunotherapy. But then what we also need to understand is that when Katlego and I recently published the South African, with a group of fantastic co-authors, the South African Rhinitis Working Group, we had a big table of about 30 different conditions that it could be. And so if you're not responding to therapy, I think it's a good advice to have an allergy test and stop at your friendly local ENT surgeon. And Katlego keeps referring to nasal endoscopy. Katlego, what's nasal endoscopy? Who does it, and why do we do it in allergic rhinitis? Can you explain the process to us? And did you do it for Seema? Seema, did she do it, and how difficult was it? Maybe you can describe that for us. If you go to your ENT, and expect what your ENT is going to do for you.
Yes, so nasal endoscopy basically is an examination of your nasal cavity using a flexible scope. We call it a flexible scope. It's not painful, I could say. It's just irritating, but it's worth doing it, because in patients who are uncontrolled on, let's say, combination therapy, which is your intranasal antihistamine combined with intranasal corticosteroid, then we should be on the lookout for other things. Like we have what we call non-allergic rhinitis as well. And it could be, non-allergic rhinitis is also broken down into so many other, forms of causes of, rhinitis. We can have tumors, which can be benign or malignant. We can have infectious diseases like it could be acute viral rhinitis, bacterial rhinitis, or it could be allergic fungal rhinosinusitis. So there are so many other causes of rhinitis we need to be on the lookout for, which can actually cause serious, health complications if they are not treated. So we've got a long list of causes of rhinitis. So, but the ones that we should be on the lookout for, especially they present with allergic symptoms, is your allergic fungal rhinosinusitis, which we see it so commonly, and other benign tumors like your inverted papillomas. We've got your pleomorphic adenomas or tumors from the salivary glands, or we can have malignant tumors as well, like your squamous cell carcinomas, your mucoepidermal carcinoma, adenocarcinomas, adenoid cystic carcinomas. So, but that's a talk for another day, right?
I think that those are also, just to put patients at ease, that would usually be one-sided. So
Yes.
so if there's, those would most often, time to also seek help is when you have one-sided symptoms. Seema, do you want to tell us about that big hosepipe she puts up your nose? Do you want to explain to the patients, is it painful? Is it uncomfortable? Do you want to explain your experience for us?
What I've experienced is that it was so scary because it has to go through your nostrils. And she had to like push it down. And I think it has a touch of some sort.
Yeah.
And I was telling her that please, don't hurt me. She took it down, like down my throat, because she wanted to, like, properly diagnose what was happening with me. And after that, she could tell me that, no, I can see that I see a bit of sores in between your throats, your neck, and your eyes, somewhere there, I don't know where. But it was very much irritating. But what can I say?
But was it worth it for you? Do you think it benefited you to sit and breathe? And Dr. Katlef, have a look.
The duration from 2018 up until 2020, because after she has prescribed them, it's fine. That is why I said I was just being ignorant as human. After she has prescribed the whole set of medication, well, I cannot pronounce them, I was okay. From 2018, 2019, 2020, that is when I could feel that, no, there's something wrong. And on seasonal occasions, I will get like a husky voice. Like now it's winter, I will be more sickly, and my nose, they will get congestion. And then when it comes to a springtime season, I will suffer from the pollen, as she has mentioned it in medical terms. I will be having like sores inside my nostrils. And when I sneeze, I will see blood. So I had to like go back to her again now and say, hey, I need you.
And has your quality of life improved since you've started taking treatment regularly?
No, it did. Definitely it did. Yeah, and I also do my own basic in the house, like also like helping myself in a way. I'm an old woman. I have kids. I use even this, which is a humidifier, especially during the spring seasons, because there's more wind and the hay fever, of which I suffer from, we have spoken about it, although she hasn't prescribed for me, but she told me that you can also like look after, moisturize your nostrils. My son is even worse than me, even though I cannot bring him in here because he's a minor, but he gets that even like his eye, the eyes are a bit brownish. So it's one of those things. I don't know whether it's genetic, but she is helping us a lot
I do
so
think
far.
you're referring to the genetic component, and brownish eyes could be a symptom of allergic conjunctivitis, meaning allergies in your eyes. It's important to get help for that. And because the more we rub our eyes, I always say to patients, you are only allowed to rub your eyes with your elbows. And
Yes.
if you're rubbing your eyes, you need to see the doctor because it damages your eyes, it damages your corneas. Tash Pillay here has commented in this section. She says her 8-year-old son, sounds like your son, Siba, suffers with sinus infections every single month. We do not give antibiotics anymore. His immune system is very weak. He's just been diagnosed asthmatic as well. He's on, she names the 2 products, and both are really good products, and oral antihistamine, both are antihistamine. She's on a combination intranasal corticosteroid and an intranasal corticosteroid, I'm assuming not together, and on an oral antihistamine. Is there anything that I could consider? It's truly heartbreaking to have these allergic rhinitis 2 weeks on and 2 weeks off. Tash, I think if I can comment there is that once done absolute conservative therapy and it's not working, it's time to have a relook. Doctors always, we prescribe something, but our expectation is to get feedback and then change our tack. So if you've been using your medication and you're consistent in your medication, but you're not finding relief, absolutely, there's what we could do, a lot that we could do. This falls into our big table that we've got. But the University of Pretoria has an immunology section where one can have a look at their immune systems. And they also manage allergic rhinitis, but that would be something to consider, is that sometimes, despite using optimal treatment, that it's preferable. Sorry, I kind of struggled there because I just saw her saying he's had allergy testing done, dairy and eggs, which we've stopped. Katlego, do you want to comment on dairy and eggs in an 8-year-old? What's your comment? Certainly, I would not take a child off dairy and eggs if they're asymptomatic and eating it. Does dairy and eggs cause allergic rhinitis?
Definitely not. Definitely not. So eggs and dairy and even your peanuts and fish, they don't cause allergic rhinitis. So allergic rhinitis is caused by, inhalants like your allergens, which is your pollen, could be from trees, from weeds, from grass. It could also be house dust mites, your cat, your dander, or even fungus or mold. So food has, it does not cause allergic rhinitis at all. And I've seen many patients coming into the practice saying, I've been told to stop eggs, I've been told to stop milk because they picked up that, there was a flag, they did a food mixture test and it showed that I'm allergic. And the doctor said I must stop because then the allergic rhinitis will improve. And I think that's where, we lose the battle, because stopping food when they really don't cause symptoms, then it's a problem because we can have serious health implications as well. So we need to make sure that the child gets tested for allergens, and we need to know which ones, are triggers in the case. But food definitely does not cause allergic rhinitis.
Absolutely, I fully agree. We're kind of nearing the end of the evening. The questions are streaming in. We've had an incredible response from people. I think I'd like to mention just allergy testing. We haven't had much questions on that other than the food. I fully want to support what Dr. Katlego says. If you have an egg, milk, peanut, wheat, fish allergy, it will happen within 2 hours. You consume the food and you have an acute, immediate reaction that could be anything from skin rash, chest closing, throat closing, and it could result in an anaphylactic reaction. Runny nose could be part of it, but that's part of that cluster of symptoms. On a day-to-day basis, if you are eating peanut and wheat and egg and milk and you are not reacting, it is not the case. And please do not take your children off this. When we grow up at the coast, dust mite is our problem in South Africa. When we grow up in the inland, it is grass. When we have a seasonal flare in spring, it is our pollen from trees and from weeds. And when we are from the inland and we get better at the coast, it's most likely a grass allergy. When we are from the coast and we come inland and we're better, it's most likely a dust mite allergy. If we are bad in both places, it could be dust mite and grass, or it could be the pet back at home. So there are many things to consider. I would like to advise you to follow the pollen count. The pollen, it will be in the feed, and that will give you a good indication of where your symptoms are. Seema and Katlego, I think if you can think about your last thoughts, I think if Katlego can answer this question for us, and then Seema, you can think about your closing remarks, maybe inspiring patients to seek adequate help, to use their medication, and then Katlego and I will finish off. So Katlego, if you can shoot on this question from Rashida Khan Omer. My son is now 16, so he's going on to an adult and has allergic rhinitis. He's been diagnosed at age 4. I'm concerned with the rubbing of his nose, sometimes over so many years. Will this lead to damage of the nose?
So, the rubbing of the nose, yes, it does cause what you call nasal septum deviation. In a long run, when you keep on doing this, the patients usually have what you call a deviated nasal septum. So we've definitely seen patients who develop or have a deviated nasal septum as a result of chronic allergic rhinitis because of course that rubbing. But if the child is on intranasal corticosteroid and the child is uncontrolled, then we can prevent the nasal septum deviation, which will occur in the long run.
Okay, absolutely. Seema, do you want to give us your parting thoughts and inspire patients because of what you've experienced?
Thank you, Marinda. You know what's painful the most? It's seeing your son, especially my child, waking up in the morning with dried mucus on his face because he hasn't slept. He's been rubbing his nose. Well, with me, I'm a bit careful because I can, wipe it off. But with him, it's something else. And sometimes I feel scared of taking him to a specialist like Dr. K, so that Dr. K can treat him because he's still developing. And I can even see that while he's developing, he looks even smaller than his age. And worst part, he doesn't even eat meat. He doesn't take eggs. He doesn't take anything. Like we've stopped. Like I don't know what to do with him. It's even worse. As much as I haven't taken him to Dr. Katlego, but with him, it's heartbreaking because I cannot even function well. He's also sickly like I used to be. He's always having a runny nose. His nose is runny. His headache is painful here. Like he's not functioning. It scares me to the core. So, but what I can advise other patients is that, especially if you're at my age, just make sure that you take your medication and moisturize your nose, because that really helped me. I used to have a very dry nose. My doctor can tell you it was so dry. Like I used to have like the scales coming out. But when I started, like, I will just smear Vaseline, not putting it inside, because that's what he told me, that you shouldn't play around your nostril walls. Rather, just for you to breathe that warm air, rather. But it's quite a very depressing sickness. I'm not gonna lie, I've been having it for like 40 years. I'm 40 now, but I'm trying so hard to, maintain and manage it. So I'm hoping that with you guys, with your expertise, you can actually come up with something that could actually help us. Because I mean, I cannot struggle to breathe whereas I'm leaving. I need to breathe because sometimes I can't breathe. I use my mouth.
Sima, we
Thank
really
you.
appreciate you. Thank you very much, and for really touching our hearts with how we can struggle. I want to encourage you to go see your Dr. K. Katlego, what's your parting thoughts?
Yes, so allergic rhinitis is relatively common. It affects about 20% of children and 40% of adults globally. However, patients no longer have to suffer alone. We've got platforms like your Allergic Foundation of South Africa. We've got allergy clinics, all over the country. And now we have what you call combination therapy, which is your intranasal antihistamine and your intranasal corticosteroids combined. So if treatment is taken regularly and adequately, then definitely the patients can have some relief. And patients needs to make sure that we are dealing with allergic rhinitis and not dealing with something else, because if we are dealing with other diseases, they can cause morbidities or complications in the long run. So, and if patients get proper testing, because usually we don't test with mild allergic rhinitis, but in patients who have been sensitized to multiple other allergens, then we just recommend that they get tested, and to so that we can know which allergen we need to address, because now we have other options like your immunotherapy, of which is a discussion for another day. But yeah, so patients no longer have to suffer alone, and we can definitely treat allergic rhinitis. They just need to be aware that there's help out there. And even those with asthma, it can be controlled if we control the allergic rhinitis.
Absolutely. I couldn't have said it better. I think it's I'm very excited about platforms like this, Allergy Foundation of South Africa, Pollen Count, and there's a plethora of information, and you can really improve your quality of life. I would like to thank our sponsors. I would like to thank my lovely guests, Siba, Katlego. I hope we meet again. Maybe we can do a chat about our eyes, chat about kids, and we'd like to do a follow-up and see you guys around. Please post more questions. We'll spend our time and we'll reply to them. There's definitely hope. There's definitely an answer. I'd like to thank our sponsors, Light Years Media, Allergy Foundation, and you guys must go make yourself a nice cup of tea, go spend time with your families, and we hope to see you for many more Facebook Live events. Thank you very much.
Yes, and we'd like to thank Beatrice for sponsoring the event. Thank you.